Welcome everyone. We're excited to share some country wisdom with you.
King Solomon had a thing or two to say about the path to wisdom. In Proverbs 4, he wrote, "Let your eyes look directly forward and your gaze be straight before you. Keep straight the path of your feet, and all your ways will be sure."
Join us now for Country Wisdom. Dr. Judy, thank you for coming today. And is it okay if I call you Dr. Judy?
That's what everybody calls me.
All right. I asked you before we started here what was maybe one of your favorite texts that kind of told your story, because you've got an amazing story. You said, Romans 15, verse 13, "Now the God of hope fill you with all joy and peace in believing, that ye may abound in hope through the power of the Holy Ghost." Powerful.
And you're right, her story is powerful. You know, you are a physician. I know you just retired, but you are still a physician. And I'm plenty intelligent, but I've always been in awe of someone with the kind of brain that can get through medical school. But your brain is part of your powerful story, because your brain had some issues.
I'll say.
That made a miracle what you've done with your life since. At least as far as, regular people are concerned, it would take a miracle to get me through medical school, even with a complete brain, let alone missing part of it.
Yeah, I miss part of my brain.
So where did it start?
Well, it actually started in medical school. I was already in medical school, and they told us at the beginning of medical school that as we were studying diseases, we would start to think that we had some of them, especially when we were studying psych. But it's true. I started to think I had, and I thought I knew exactly what it was. So I went to student health and told them my symptoms and told them the tests I wanted them to order.
What kind of symptoms were you having?
Yeah, I was in my early 20s, and my periods became irregular, and I was not, I didn't have any babies, and I wasn't breastfeeding, but I started lactating, and so I thought, I have a pituitary adenoma that's putting out prolactin. And I went to student health and I asked them to measure a prolactin level, and I said it might be high, and it was high. So the next test I wanted, and of course, I was obnoxious, but I wanted them to do some imaging to look at the pituitary to see if there was a little mass in there that might be putting out the prolactin. So of course.
So you ordered your own test?
I did not. I went to student health. I didn't want to have to pay for it, but I went to student health and they ordered the test, and I went merrily on my way thinking I was a smart medical student. And this was before the time of cell phones, and so some hours later, the resident called a number. Anyway, it was a complex process, but they got a hold of me, and the resident on the phone told me, "You do not have a pituitary adenoma. Your pituitary's lovely. You have a huge mass in your left hemisphere. It looks like a glioblastoma. You'll probably be dead in 3 to 13 months.
That's what they said?
He hadn't taken the class in bedside manner yet, had he?
Well, I was very upset. And
That sounds, I've got to ask you, that sounds very gentle. I was very upset. Was there any more to it than that?
well, I was terrified, and I was crying and walking. I was just on the campus, walking along, crying. I don't think I was screaming. I think I was just crying quietly, but Will Alexander saw me. Will Alexander was one of our teachers. He was taught us spiritual medicine, taught us how to, he, by the way, did not like the way the resident had told me.
I guess
And
not.
Really?
Yeah. And he talked to that resident, and he talked to me about how I was never, he believed in me. He thought I was still going to get to practice medicine. I, at that moment, did not think I was. I thought I was going to be dead in 3 to 13 months. But Will Alexander, stuffed me in his car and drove me out to where my husband was so that I didn't have to be alone that night. So I was grateful for that.
But tell us some more. I mean, where do you go from there?
Okay.
Dead up 13 months was all you got, perhaps. What
Okay,
next?
that's what I thought. Because it had such a grave sounding prognosis, I was anointed. Two pastors prayed for me and anointed me, and we prayed for healing. And my husband prayed that I would be healed. We'd only been married 3 years, and he didn't want to lose me at that moment.
At that moment.
I think there are moments when he wouldn't. No, most of the time he wants to keep me. Anyway, at that time, we prayed, and all my symptoms got better. All my symptoms completely resolved. The mass did not go away. Whenever they did scans, it was still there, but I felt fine. And we consulted with the neurosurgeons there in Loma Linda. They're wonderful neurosurgeons there. And everybody agreed. We all, prayed about it and decided I would just keep on going in medical school. And if my symptoms got worse, they would deal with that then. Everything stayed fine. I finished medical school. No residency wanted to take me because everybody knew I had a brain tumor. And I had to go to this new residency that was just forming, that was desperate for residents. So I started that, and it was fine. And after that year there, while Bill was finishing his pediatrics residency, opened up for a resident at the family practice residency in Hinsdale, Illinois, which I thought was the best family practice residency. So they opened up this spot. There was a spot opening because a resident was leaving. I applied for it and got it, and we moved back there. And I thought everything was fine.
Because you thought you'd been healed.
I thought I'd been healed. I thought God had healed me. And so I was going on with my life, and I had a baby because I thought I was going to live to raise her. When she was 1 year old, or almost 1 year old, I was busy. I was trying to be a mommy. I was trying to be a resident. And the resident, they estimated it was 80 hours a week of work.
Only 80?
Yeah, that was the estimate.
I remember when Steve was going through his residency.
Sometimes it was all 100 and,
yeah.
How many hours are in a week? 156? Anyway, sometimes it felt like the whole time was given over. Okay, so I was very busy, and I had arranged my schedule so that I had the lightest rotations when my baby was little. Now she's was several months old, she was more than 6 months old, more like 8 or 9 months old. And I had my ICU rotation, which was pretty intense. And I was so tired. But I thought, of course,
you're a young mom and you're in residency.
Yeah.
Either one of those could kill you.
Exactly. Well, or at least make you tired. And so I was tired, and I was waking up with a headache every single morning. And I started getting really nauseous. And I wasn't pregnant again, but I was really nauseous, and I was starting to throw up in the mornings, but then I'd be okay, and the headache would go away. And so I was just not paying any attention to it.
Did you know that an active prayer life is good for both your physical and emotional health? It can reduce anxiety, help you recover from depression, improve your immune system, and even increase your lifespan. Not bad for something that's completely free. And speaking of free, if you'd like to learn how you can start or improve your prayer life, you can order this free booklet, The Healing Power of Prayer, at talkingdonkeyinternational.org. Request offer number 143. You know the impact of Christ's message. It heals, it transforms. Do you have the eye for a great post, the heart for a kind comment, the skill to build community?
Talking Donkey International is looking for passionate volunteers, from seasoned content creators to newcomers.
We are a Christian community dedicated to sharing Christ's love.
This is a real opportunity to turn your time into ministry. Scan the QR code
to make a lasting impact.
Hey Janice, how are you doing?
Hey, you wrote another book.
I did. Had a burden on my heart, and God helped me get it done.
So, The Plan of Love, what's it about?
Well, it's really about God in eternity. Saw everything that was going to happen here, and His amazing love. He says, I'm going to take care of the problems. I'm going to take care of the situation by giving my own life. He did all that, but we've been lied to so much, we don't see what God has planned for us, what God is doing for us. Matter of fact, the angel came down to Mary and said, You shall call his name Jesus, for he shall save his people from their sins. Notice it wasn't in, but from.
Where can people get the book?
Hey, I'm glad you asked. Folks, if you'd like your own personal copy, log on to talkingdonkeyinternational.org. And please, if you would, send us a donation of $12
Or more.
or more, and we'll get you the book, and I'll be happy to sign it for you too. Thank you so much.
Because things go away magically when you ignore them. don't
Right,
they?
right.
That's my mantra.
And I really believed I'd been healed. So I wasn't even alert looking for signs of
It truly did not
brain tumor.
cross your mind that I wonder if it's back?
Because
you were so convinced you were healed?
I was really convinced I was healed, and I was probably in horrendous denial, but it wasn't uppermost in my mind. I was really busy.
What did Bill think?
You'd have to ask him. Bill is a very private person. But he wasn't expressing to me that he was worried about it until I was throwing up and feeling awful. And one day, I was at the hospital because I was in the ICU rotation, so I was there all the time. And my dear friend, Anita Blake, is a nurse. She noticed that I was sick in the morning. I was throwing up, and I was trying to get all put back together so I could go do rounds with. And she said, "Aren't you the resident that had a brain tumor?" I said, "Oh yeah, but that was a long time ago." I said,
I'm fine.
I'm fine. I'm fine. And she said, "When was the last time you had your brain scanned?" I said, "Oh, I don't know, a year ago, before I had the baby, before I was pregnant, in fact. It's been more than a year." And then she disappeared and came back, and she had an appointment time for me to have my brain scanned. And this time they were very careful how they told me. I wasn't the same person, but they sat me down and were very kind and said, "This tumor looks a lot bigger than it did on the previous study.
Oh, wow.
And it's putting a lot of pressure on your brain, and we want to talk with the surgeon about doing a surgery to try to take out as much of it as they can."
And did life crash down?
Well, that's when Bill got very concerned. We all got very concerned, and we prayed a lot. Because now I had this beautiful baby. She was a very beautiful baby. And I thought, she needs her mommy. And I really wanted to be there when she was graduating from high school and doing all the things that people do. And I was really worried I wouldn't be there for all those things. But we prayed and prayed and prayed. Everybody prayed. My mother prayed. My father prayed. Everybody prayed. My friends, people who didn't even know me, everybody prayed. And they decided that the best thing, the surgeons decided that the best thing to do would be to go ahead and do a surgery and try to resect as much of the tumor as they could. But the surgeon that was going to do the surgery, the neurosurgeon, Dr. Hill, talked to me, and he said, it looks that besides looking larger, it looks a little different on this latest image. It looks like it might be encapsulated. Maybe there's a little capsule around it. Maybe we could get that whole tumor out, and you could go on with your life and it would never come back. I said, that sounds good. And so that was the first question I asked when I woke up from surgery is, did you get it all?
Did you, going into surgery, feel like the hope, we talked about hope in that verse. Were you feeling hopeful, like, I think this is going to work? Because I tend to go to worst case scenario, it's my natural habit.
Okay, the problem for me at that time, the reason why that verse is so important to me is that I had gone through thinking I was cured and then finding out that I wasn't. And so I wasn't sure what God was doing. I think
I would have found myself thinking, God, why do you let me have this baby if you knew I'm just going to die?
Well, I wondered that too. I wondered if I had done something wrong, if I wasn't listening to what God was telling me, if I wasn't doing life right.
So what I hear you saying is you really had an experience with God. You wanted to follow God.
Oh,
you
yes.
wanted to do His will. But now all of a sudden you're in the valley here and the mountaintops look pretty high.
Yes. And the shadows look pretty deep, and I wasn't sure. I was having a hard time having hope. But God is the God of hope, and God is the one who fills us with joy and peace in believing, even when things are going badly. I went through a period of time in there where I was thinking, if I had to have a tumor, why couldn't I have a tumor in my toe? I mean, I didn't want a tumor in my brain. The brain is where, that's who you are. And so I was, and I felt like, I know bad things happen in this world, even to people who don't deserve it. I knew I hadn't intentionally abused myself in some way that we know causes brain tumors. I didn't think I had intentionally caused this. But I did. I struggled, but I wanted to come to that sense that God is the God of hope. And so I just looked at my little daughter and I thought, well, my hope is that I can survive and raise her. Maybe that's what God wants. And I just put it in God's hands. I just said, I don't know what you want, God, but I want what you want, and I'm willing for you to do it your way.
Did that give you a peace?
Oh yes, that helped me a lot. That made it easier for me to relax into it. So I just trusted, and I know everybody was praying. Everybody who knew me, even people who didn't know me, just knew of me, were praying. There was a lot of prayers. And, I struggled because when I first had my brain tumor way back in medical school, a colleague of mine, Bill Knopf, who was a student in my class, he got a brain tumor that was found after mine was found, and his first symptom was he wasn't able to finish a marathon. That was his first symptom of his brain tumor.
So he was healthy.
He was healthy. He lived a very healthy lifestyle, and he already had a little child, but he was dead within a year. In fact, just months. And I felt so guilty. Why am I still alive? I mean, he was a better student than I was. But now, when I'm back to this point where I'm going to have surgery, I just thought, okay, God loves us all, even if I die. That doesn't mean that God didn't love me. I knew that God loved my colleague, my classmate. God loved him too. Even though we have bad things happen to us in this world, that doesn't mean we're not loved by God. It doesn't mean that at all. So I went into the surgery with hope and peace. I really had peace. And when I woke up in the recovery room, the first thing I asked him was, did you get it all? Because that's all I cared about. I cared about other things, but it was my top of mind thing. And they said no.
Did you know that an active prayer life is good for both your physical and emotional health? It can reduce anxiety, help you recover from depression, improve your immune system, and even increase your lifespan. Not bad for something that's completely free. And speaking of free, if you'd like to learn how you can start or improve your prayer life, you can order this free booklet, The Healing Power of Prayer, at TalkingDonkeyInternational.org. Request offer number 143.
Hey, Janice, how are you doing?
Hey, you wrote another book.
I did. Had a burden on my heart, and God helped me get it done.
So, The Plan of Love, what's it about?
Well, it's really about God in eternity. Saw everything that was going to happen here, and His amazing love. He says, I'm going to take care of the problems. I'm going to take care of the situation by giving my own life. He did all that, but we've been lied to so much, we don't see what God has planned for us, what God is doing for us. Matter of fact, the angel came down to Mary and said, You shall call his name Jesus, for he shall save his people from their sins. Notice it wasn't in, but from.
Where can people get the book?
Hey, I'm glad you asked. Folks, if you'd like your own personal copy, log on to talkingdonkeyinternational.org. And please, if you would, send us a donation of $12
Or more.
and we'll get you the book, and I'll be happy to sign it for you too. Thank you so much.
And they said no. We got as much as we could, and there was a little bit left, but don't worry, they said. I said, okay. And then he turned to
Don't worry.
he turned to my husband and he said, she won't remember this conversation. And I said to Bill, yes, I will. Because I was still groggy from the anesthetic, but I still to this day remember that conversation, and I was so disappointed. But I kept going back. God is the God of hope. Even if the surgeons, the human technique couldn't get it all, that doesn't for sure mean that it's going to grow back. I don't know what it means. I didn't know what it meant at all. So I'm recovering, but my recovery was pretty rocky.
What's the normal recovery after brain surgery?
I suppose it's always rocky, but this was the only brain surgery I had, so I thought it was rocky. And at one point they were transferring me from, I try to do what I'm told. I really try. And they were transferring me from one bed to a gurney, and they said, can you just hop from here to here? And I said, is that what you want me to do? Because I'm all wrapped up in this bandage. I'm almost completely blind. I had huge visual field defect. I could only see a little bit on the left for each eye. The central vision was completely gone. Everything on the right was gone. I couldn't see that gurney they wanted me to jump onto, but and if I didn't close one eye, I would see double. I couldn't get my eyes to focus together. So I was pretty out of it. And they said, can you just move from this one to this one? I said, okay, I'll try. And I got up and fainted on the floor. I really try to do what I'm told, but that was not a good one. Anyway, they got me up, I guess. I eventually ended up on, okay. So I had the surgery and I had a long recovery. And little by little, things came back. I had to learn how to read again. I had to learn how to do
You're
everything.
a doctor in practice, and you got to learn how to read again.
Yeah.
I would have given up.
Well, I
would have
wanted to give
decided,
up.
I guess God doesn't want me to be a
That's
doctor
what I
after all.
thought. That's what I thought. And so I told the director of the residency that I was resigning, and he wouldn't accept my resignation. So little by little, I had to learn every single letter of the alphabet again, uppercase and lowercase. I had to learn them all. I had to learn how to sound out words again. I remembered things. I remembered B says ba. I just couldn't remember what a B looked like.
Well, how long a period did it take you to accomplish all of that?
Well, I started to learn how to read again very quickly, but it took me many months before I could reliably recognize every single letter. And I had to sound out every word, and I read very, very slowly.
And you were still practicing physician.
Well, it took me many months after the surgery before I could come back to my job as a resident. When I came back to my job as a resident, I needed lots of help because I had absolutely no sense of direction. And I couldn't remember where anything in the hospital was at all. And so I would go in and I would talk to the.
So it's like every day you were in a different building?
Well, it was
as far
completely
as
unfamiliar.
your memory went?
Everything was unfamiliar. I didn't know how to get places. So I would go to the ladies at the front, the volunteers, and ask them whatever department I needed to go to. I would ask them to lead me there. Like where is pediatrics or whatever.
How did that mentally affect you? I mean, aside from a brain tumor, how did that affect you with all of a sudden?
How did you not give up?
Yeah.
Well, yes, I was very discouraged, and I thought I had so many doubts. I thought maybe, I don't want to give my patients an inadequate physician. I don't want to be not doing the best possible for them. That's why I wanted to quit.
Well, Dr. Judy, we've only got about 3 minutes left, but I want to hear that struggle. And you're here today, so praise the Lord. I mean, you made it.
Yeah, and my daughter grew up.
Daughter grew up. For our audience, though, with a couple of minutes left, how on earth, where'd you get that strength? I know it's easy to say the Lord, but where did you really get that strength?
I had so much support. I had so much love from other people and encouragement. The residency director, when I went in to resign, he said, "You have something special. You need to use it." And so I did a little test. I thought, if I can pass my board exam with as limited as I am, that would mean I have enough capability to actually do the work. And so I took the exam and I passed. Praise the Lord.
How many doctors fail the first time around?
Oh, usually 30 to 40%.
And you still weren't reading.
I had to sound out
like most people.
I had to sound out every word, and I had to. I've gotten a lot of my vision back since then, but I had to, use like a piece of paper to help so I could stay on the right line, so I could fill in the right oval for the question that I just read. Yeah, it was very challenging. But
I know that you still have some deficits. Which
Oh, yeah.
side? There's one side
can't
that you
see.
still don't.
I can't see very well to my
So
right.
if you want to sneak up on her.
Yeah. Yeah, and when I'm driving, I'm scanning all the time because I don't want to not notice something coming off, towards my car.
So would you say you've had a fruitful practice?
I can tell you that she has.
Thank you.
I hear from her patients. I know some of them.
Something. It's just absolutely so amazing to me, the things you went through and what God did bring you through. Let me ask you this quickly, minute left. Would you choose to be led on any other path?
That's the thing. When I first found out I had a brain tumor, I said out loud to my husband, "I'm never going to be glad I had a brain tumor."
That's a little too Pollyanna for anyone, right?
I'm going to be glad. But because of everything that's happened, I am so glad. I am so glad.
I think that it's made you a much more empathetic physician.
Oh, I think so too. I think God knew I needed an experience like this in order to become the person He wanted me to be.
Thank you so much. I mean, we can't say anything else. It's just an incredible testimony, an incredible story. Thank you very much. Quickly, folks, if you've got problems in your life, and I bet you do, here's an example. Reach out to God, talk to Him, grab a hold of Him, never let Him go, and He'll get you through it. Thank you for watching. Join us again for another exciting Country Wisdom.
See you next time.